is Wesley Boudreau, one of the financial advisors here with the Retirement Group. Today we're going to do a quick overview of different healthcare costs associated with the retirement process for Fortune 500 companies and kind of go over what you may have with your company, you may have to take care of on your own, and then also where Medicare comes into play. Now, before I get started, I just want to remind everybody the Retirement Group, we are an independent financial advisory firm that focuses on working with corporate employees, many of those Fortune 500 companies that we talked about. We've been doing this for about 30 years or so. Our goal is to actually have a deeper understanding of your specific benefits plans so we can walk you through that transition period to avoid common mistakes when it comes time to electing when to retire, how to navigate the pension, the 401k, and healthcare options within your company, because a lot of those we've seen have changed over the last decade, and some are changing as we speak this year as well. And we got offices throughout the country, so rest assured if you need to sit down with somebody face to face, we can still take care of that, or we can obviously talk with you on the phone, set up a web meeting, or exchange emails as well. One of the best things that you can take advantage of from us is our complimentary cash flow analysis. This is a detailed financial plan specific to your company's situation to help you determine the best day to retire. So when I mentioned before items like the pension and the 401k and healthcare, we can tie all that together, look at various dates to show you different options of when to retire, so you can make sure you don't make any mistakes and leave any company money on the table. And then from that point, it'll also help us back into an appropriate investment strategy should you decide to work with us going forward as well. Now, as far as healthcare costs, there's a couple things we're going to go ahead and talk about today. We'll first talk about the factors associated with that transition process in retirement. We'll talk about some individual healthcare options you may have outside of the company plan or within the company plans. The A's, B's, C's, and D's, essentially the different Medicare options you have. Things to pay attention to, and then also how to cover that gap in some of the Medicare options. And we do have a more detailed webinar that goes into Medicare. If you want to give us a call, we can get that information over to you as well. Now, as far as the healthcare cost to consider, as we transition into retirement, it used to be that most companies had retiree medical, and a lot of the ones we still do work with continue to have retiree medical. However, we've seen changes quite a bit over the last 5 years or so, and changes where we've seen some reduce or eliminate it altogether. Some where they increase the amount that you are responsible for, and then others it's based upon when you decide to retire. Those things are going away year by year. So if you have questions on that, give us a call. We can go through that, look at your summary plan description, or tell you kind of what your options are. We just went through a major company change last year where we saw a lot of managers potentially losing their healthcare benefits as retirees if they waited a year later to retire. So there's a lot of things that factor into the equation. Because that retiree medical is going to help you prior to Medicare, which kicks in at age 65. So otherwise, if you, let's say, retire at 58 or you retire at 60, you've got 5 or 7 years ahead of you of trying to cover medical expenses yourself before the so-called cheaper Medicare kind of kicks in. Now, it's also been a study that the EBRI has actually said that Medicare is only going to potentially cover about 60% of your true medical cost going forward, and it could get lower. So that's why we also need to talk about the different Medigap and Medicare Advantage options you could see as well on top of covering your insurance yourself. Now, as far as the healthcare costs, like I said before, it used to be that most companies would provide retiree medical. We still see that with a lot of companies we do work with, but keep in mind those some have changed and some are changing going forward. So it's really important to kind of know about this, because a lot of you may have hired on 20, 30 years ago with the intention of having that retiree medical. So now it becomes a bigger factor into running your cash flow analysis in your review. Like I said, if somebody retires at 60, they got 5 more years of medical costs before Medicare kicks in. We need to review the options. Do you have retiree medical? Do you get to go out there and buy it on your own? And what are your choices there? So there is that gap between now and age 65 if you're retiring earlier. And then if you're married, you may be 65, but you may have a spouse who's 63, 62. So you have to look at coverage of him or her as well. Now, if you do not have the retiree medical, one of the options you have is going to be looking at the Affordable Care Act. There's the marketplace where you look state by state the different insurance options available to you. But unfortunately, those get pretty expensive. They are going to be more expensive than what you're paying right now through the company plan. But that's kind of the key way to look at it, or the key option that most people go. There are some other options to discuss. You can look at indemnity plans where they pay a multiplier of what Medicare would pay, or maybe a concierge services where you're paying a fee to get all your health, all your basic health care from a primary care physician. So there are other options out there, but it is something you need to be aware of as far as the cost associated with it, transition into retirement prior to age 65. When we get to age 65, like we said, that's where Medicare is going to kick in. You need to go ahead and look at signing up for that about 3 months prior to age 65. And there are different parts of Medicare. It's not just a simple insurance plan like your company plan. There's Part A, there's Part B, there's Part D, there's Part C, there's K, G, F. There's a lot of different options, but the key core components are going to be Part A and Part B, and then Part D. So Part A is actually going to cover your primary kind of hospital and inpatient situations if you have to go into the hospital for surgery or something happens. Part B is the one we see more of the day-to-day use, which is your medical and outpatient insurance. And then the Part D is going to cover prescription drugs if you need to look at that as well. And then what's going to happen is Part C actually is going to be a Medicare Advantage option where you can kind of go out privately and look at companies within the state that will cover both A and B, and also give you some options out of state as well. If we look at kind of the different things that Medicare does and doesn't cover, be very careful and keep in mind that it's not a blanket approach where it covers everything. Even if you go in there and get Part C that covers a little bit more, covers A and B, and covers some of your co-insurance and things like that, or even if you go out and get Medigap, which we'll talk about in just a moment, that may not even cover some things like long-term care, most dental care. Some of them do. It just depends upon the options you choose when you go through those choices. Acupuncture, chiropractor, hearing aids, things like that. Stuff that we do see retirees end up needing time to time as well. So just be cognizant of that. Another thing to remember is there's costs associated with it. Generally speaking, if you've had over 10 years of contributions into Part A, there's not going to be a cost there. But for Part B, it could be $170 a month all the way up to over $400 a month, depending upon what your income was 2 years prior. That's another item to juggle as far as your costs associated with it. Whenever you first retire, let's say if you retire at 64 or 65 and go into Medicare, it's probably going to cost you more for Part B initially because you're coming off of a current income. However, if you're retired for a couple years, it may not cost you as much. It may be that bottom 170 figure or so as well. As far as the kind of the coverage we mentioned, you got your Part A, which is your hospital, your Part B, which is going to cover your medical, and then the Part D we said again was the prescription drugs. So that Part C I mentioned before, which you also call the Medicare Advantage, is going to actually cover kind of a blanket approach where it covers all these in some cases. And then there's also Medigap, where Part C won't cover everything. We mentioned again the options like dental, hearing aids, things like that. There's going to be other items like Medicare Part F, Part G, Part K, Part L, Part M. We're not going to go into all those, but they're all different based upon what they cover as far as ancillary items and also how much co-insurance they cover. So a lot of those can also be built in there, so it covers your deductible, your co-insurance, so you kind of know going into it year by year what your max pay is going to be associated with Medicare. As far as kind of looking at this, like we said, as a quick overview, just keep in mind that as you transition to retirement, healthcare is one of the number one priorities on people's mind, because that is definitely a culprit as far as rising costs associated with retirement. So if you have questions on there, let us know. We can go through that, update the cash flow analysis for you. But you need to factor in those costs based upon your age and how much you'll have to pay prior to age 65. And then Medicare is a little bit easier to manage going forward. And you want to make sure that you do have a plan. And then as far as getting that plan together, making sure you understand the right day to retire, how to tie in these medical costs, just give us a call and we can actually go through that and put that cash flow analysis together, give you a better, clearer picture of your specific situation. And then, right now, about 3/4 of Americans over 50 actually don't have a written plan. So again, I mentioned that cash flow analysis. If you can give us a call, spend about maybe 10 minutes gathering some data from you. Give us about a week. We'll put that report together, get it back over to you, and sit down and go through it. Let you know where you stand on the medical costs. Let you know where you stand on your pension, your 401k, retirement process. If you're in good shape to retire now or later, or look at various dates based upon what you were looking at. But at the end of the day, if you're going to work with a company, you need to look at running a cash flow analysis so they understand what your situation is before they start making recommendations. So it's better to know what you're trying to solve for than back into that, obviously. Now, with that, I want to wrap it up, and I want to thank everybody for taking a little bit of time out of their day to brush up on this topic. But if you have more detailed questions, because everybody's going to be more specific, just give us a call at 1-800-900-5867, or you can reach us at info@theretirementgroup.com. Also, if you want to hold up your camera phone, you can actually schedule a meeting with myself or any of the other advisors here at the Retirement Group with one of these QR codes. Or you can also follow us on LinkedIn. Go ahead and get into your specific company site so you can be updated on the information we post on interest rate changes, medical changes, all that kind of stuff that's specifically related to your company, so you stay up to date on that as well. And again, just want to remind everybody that the Retirement Group, we do work with a lot of different companies, but we are not affiliated with, nor are we employed by your specific company. But again, given the amount of time we've spent working with those companies, we have a deep understanding. So if you have any questions on your outside of Medicare and outside of the medical cost, questions on your pension plan, your 401k, give us a call. We can help you out with that as well. With that, I want to thank everybody for taking a quick moment, and I hope you have a great day.